Hi everybody, David Ford, Director of Pharmacy and Redevelopment here at North East Health in Wangaratta, on another beautiful day in the North East. So welcome to this wonderful place. Last time when we spoke about the redevelopment, we were about to start the demolition of the old emergency department, and you can see that that's actually happened now. If you look at the corner of Green Street and Cusack Street here, the old emergency has been actually removed. That circular area at the front's been demolished. The walls have been demolished, and now we're in preparation to pour the slab, which will be for the new emergency department. That'll create us an additional 6 treatment spaces, some additional consulting spaces, a behavioural assessment room, and will increase the capacity of the emergency department for years to come. So one of the great challenges that we're facing at the moment is trying to rebuild the emergency department in the middle of winter, where it's cold and rainy, but also in the middle of a global pandemic. So as we just showed you before, we've started the demolition of the emergency department, but that's now created challenges for us about how the community come into the ED. So what will have to happen is you come in this way now, into what was the old driveway of the emergency department. But what we have to do is we have to make sure that when people come to the hospital, that we test them whether they have COVID or not before they can come into the hospital. The only way we can do that is to triage people out here. Now out here, it's cold, and we've tried to cover this as best as we can, but it's creating a challenge for us. So if you come into the emergency department, I'd really recommend that you wear something warm, because what we're going to have to do for a little while is to have you wait out here for a minute while we do a COVID test. Once we figure out the COVID test, that will decide which part of the hospital you need to go to, and then we can take you inside. If we need to do something different, then we can take you into a separate room we have in here, but we only have limited space. We've tried to put some heaters into the area to try and keep the area warm, and we understand this is far less than ideal, but it's what we have to go through in order to get to the end of this project. So if you're going to come to the emergency department, please be patient. Please wear something warm, and understand that you will need to wait outside for a little while we do the appropriate tests to make sure that you're safe, and our patients are safe, and our staff are safe. All right, so here we are in the medical or paediatrics part of the build. So we've spoken about the ED part of the build. This part of the build is still continuing, and as you can see, we're well on the way to getting this done. The first floor and the slab has been put in place, the structural steel is in place, the roof's on. The bricklayers are starting to lay bricks around the outside, so as we start to seal this. Inside, we're starting to do the internal fix, so internal wall frames. We're roughing in electrics and power and data and nurse call and air conditioning and window frames and all the things we need to do inside. So despite the weather, we've been able to crack on in here because a lot of that rough-in works is all undercover. So Zorna are continuing at a really good pace, and this is progressing really well, as you can see. Since we spoke last time, we've got some additional funding to do some works to refurbish the maternity ward. So you can see up here behind me, we're starting to do some work on what was an external area in maternity. We've now put some roof, some external structural steel, relaid the floor, and this will become an extension of the maternity ward. Now in here, we're going to do this build in various stages. This is just stage 1, where we can clad and use what was previously open floor space and encapsulate that and make an additional space for our maternity staff. This bit we're going to do in stages, so this is stage 1 of that part of the build.